Hello, I'm Dr. Eugene Harrington, and on behalf of Dr. Gail A. Maddox, I would like to welcome you to the Historically Black Colleges and Universities Center for Excellence in Behavioral Health, located at Morehouse School of Medicine in the Department of Psychiatry and Behavioral Sciences. The HBCU Center for Excellence serves as a unique center designed to facilitate, develop, collaborate, support strategies, and promote opportunities for HBCUs to address the behavioral health needs of students and foster workforce development. The overall goals of the HBCU Center for Excellence are to, number one, promote student behavioral health to positively impact student retention. Number two, to expand campus service capacity with a focus on culturally appropriate behavioral health resources. Number three, to facilitate best practices and dissemination. And lastly, number four, to foster student leadership and behavioral health workforce development. Good afternoon, everyone. It is our pleasure. I'm Dr. Harrington with the HBCU Center for Excellence. I'm the co-project director, and we're very pleased to offer seminars to the 105 HBCU colleges and universities. The HBCU serves the 105 colleges and universities in behavioral health, primarily around education, awareness, around drugs and substance abuse and mental health issues. And it's my distinct pleasure to introduce our webinar speaker for this afternoon, who is Alicia Ryan, and she is from the island of Antigua and Barbuda, West Indies. She is an alumnus of the University of the Virgin Islands, St. Thomas campus, where she obtained her Bachelor's of Arts degree in social science. She has a driving passion to give back to her community and educating others. Mrs. Ryan is an active member of the Student Peer Educators organization on her HBCU campus, as well as other behavioral health groups she holds membership. While at UVI, she assisted with organizing events such as the first HIV testing jam and health screening, which raised awareness about the plaguing HIV/AIDS epidemic and Red Ribbon Week activities. Currently, she is a member of the Center for Substance Abuse Prevention, CSAP, and she's a fellow there with CSAP, and she's in the Virgin Islands Prevention Fellowship Program. At the end of her time with CSAP and during her fellowship, her aim is to become a certified substance abuse prevention specialist in alcohol, tobacco, and other drug uses, as she sees these problems and issues in many communities and at many campuses. She will continue to work in that area, and of course she has first-hand knowledge in there as well, and she will provide assistance and coordinate activities around substance abuse prevention, working with schools, communities, groups, and other agencies. And substance abuse prevention aims to reinforce abstinence or proper use of alcohol and drug prevention from being misused by others on the campus and in community. And that is her passion. And with that introduction, I will turn it over to Alicia Ryan.
Thank you, Dr. Harrington. Thank you, Christine Livingston, for the invitation to participate in the Behavioral Health webinar series. Dr. Harrington and Trent Jones for your assistance in putting together this PowerPoint presentation. The Substance Abuse and Mental Health Services Administration, SAMHSA, abides by the vision that behavioral health is essential to health, prevention works, treatment is effective, and people recover. Our webinar this afternoon will focus primarily on alcohol, tobacco, and other drug use at historically black colleges and universities, different elements of cultural competency, and how it all applies to prevention. Prevention does work, and it takes devoted and committed teams such as peer educators, and other task forces to disperse knowledge on substance abuse prevention. In dispersing information, presenters should have the ability to speak publicly in a positive, engaging, and interactive, non-judgmental manner, facilitate group discussions, and include all members of the audience, function in a group both as a leader and as a supportive member, and also show concern and empathy in a one-on-one information sharing format. This webinar will focus on the following objectives. First, to describe prevalence of ATOD, which may include but not limited to marijuana, cocaine, synthetic drugs, heroin, PCP, on historically black colleges and universities, to describe how to assess substance use and related problems through the use of qualitative and quantitative data, to identify risk and protective factors that contribute towards ATOD on HBCU campuses, to describe how to assess a college community's readiness and resources to address these identified problems. This will also include sustainability. And finally, to explain culture and how to apply cultural competence to ATOD prevention and promotion. For students who may be on this call, it is important that you remember that as a student, your life extends beyond the classroom. Learning to make healthy choices include whether or not to use substances like alcohol, caffeine, tobacco, and marijuana. This is just one of the challenges you will face. Substance use is not considered to be a problem by most with regards to moderate use of alcohol and prescribed use of legal drugs. Misuse, however, is a term used to describe the use of alcohol or drugs in a way that begins to have negative impacts on the individual or others around the individual. Any use of alcohol by minors and any use of illegal drugs by minors or adults is considered misuse. Both substance abuse and substance dependence refers to maladaptive patterns of substance use. Substance abuse usually refers to using any substance in a way that leads to a failure to fulfill major responsibilities such as attending work, school, or other interpersonal problems. Substance dependence usually manifests as continued use of a substance despite negative physical or psychological effects. The culture of drinking on U.S. college and university campuses has gained widespread national attention. Researchers cite the disturbing consequences of drinking on campuses each year. In a study, it showed that on an average, about 1,700 college students died from alcohol-related causes in a year. Also showed that 600,000 unintentional injuries, 700,000 assaults, and 100,000 cases of sexual assaults and acquaintance rapes occurred as a result of alcohol or other drug use. Did you know, in recent studies, they confirmed that students at HBCUs and African American students in general drink far less and as a result suffer fewer consequences than the students at predominantly white institutions. This disparity in alcohol consumption appears to be strongly related to factors such as HBCU's emphasis on character development in their institutional goals and the enrollment of many students with strong religious values. As a result, the atmosphere at HBCUs militates against the culture of drinking found on so many other college and university campuses. Let us take a glimpse at a prevalence report of alcohol and illegal drug use that was completed in 2005 by the Core Institute of Southern Illinois University. In the first slide, it shows the prevalence of alcohol used by African American students, and also it shows the prevalence among different populations. In this slide, we can see that African Americans ranked the lowest in terms of alcohol use. We ranked 23.3 versus American Indians, who had an accumulated percentage of 52.6. In the second slide, it shows the prevalence of marijuana used by African American students 30 days prior to the study. And we ranked the second least with Asian and Pacific Islanders being the least with 8.8, and Hispanics being the greater population with 17.6. Illicit drug use at HBCUs and among black students in general is a topic of limited resource. The Core Institute analysis of responses from 3,379 students in 2005 found that only 5.4% of the African American student population reported using any type of illicit drug other than marijuana. Additional research is needed on the issue of illicit drug by African American students at HBCUs and at other institutions, particularly on the abuse of prescription drugs and other substances rising in prevalence. The Center for Substance Abuse Treatment, CSAT, has conducted the largest investigation to date of alcohol, marijuana, and tobacco use by HBCU students, along with the Higher Education for Alcohol and Other Drug Abuse and Violence Prevention. Writer Daniel Kapner highlights that African American students drink less frequently and in smaller quantities than other racial or ethnic groups on campus. Also, he noted that African American students at HBCUs drink approximately the same rate as African American students at predominantly white institutions. Another point is that white students at HBCUs drink less than white students at non-HBCUs do. Black student athletes drink less alcohol than white student athletes do, and black athletes are more likely than their white counterparts to abstain from alcohol. And finally, this study highlighted that students at HBCUs use marijuana less than the students at predominantly white institutions. Substance use, abuse, or dependence all fall under the umbrella of behavioral health, which refers to a state of emotional, mental being, and/or choices and actions that affect health and wellness. Individuals engage in behavior and make choices that affect their wellness, including whether or not to use alcohol, tobacco, or other drugs. College communities can also impact choices and actions that affect wellness, such as peer educators conducting drug-free events, focus groups, dormitory and classroom presentations. Before we go further into the webinar, let us look briefly at the 8 dimensions of wellness. Wellness is defined as a conscious, deliberate process that requires awareness of and making choices for a more satisfying lifestyle. It is not merely the absence of disease, illness, and stress, but the presence of purpose in life, active involvement in satisfying work and play, joyful relationships, a healthy body, and living environment and happiness. SAMHSA identifies and promotes 8 dimensions of wellness, and we'll look at them briefly. They are emotional, financial, social, spiritual, occupational, physical, intellectual, and environmental. Emotional has to do with how well a person is able to cope effectively with life and create satisfying relationships. Financial focuses on a satisfaction with the current and future financial situations. Social looks at developing a sense of connection, a sense of belonging, whether it's to a group or an organization. Spiritual expands our sense of purpose and meaning in life. Occupational has to do with a personal satisfaction derived from one's work. Physically, it recognizes the need for physical activity, diet, sleep, and nutrition. Intellectually, it's recognizing creative abilities and finding ways to expand knowledge and skills. And environmental has to do with good health by occupying pleasant, stimulant environments that support well-being. A representative from the National Association for Equal Opportunity, let us now look at how to make assessments and gather data to assist with effective prevention. It says here, risk and protective factors exist in multiple contexts, and highlighted in this picture we see society, community, family, and self being the main focus areas. Risk factors are defined as characteristics at the biological, family, community, or cultural level that precedes and is associated with a higher likelihood of problem outcome. Some examples of risk factors that may be associated with substance abuse include early onset depression and anxiety, and we're looking at risk factors in early adulthood, parental depression, attending college, substance use peers, and the list can go on. On the other end of the spectrum, protective factors are characteristics associated with a lower likelihood of problem outcomes or that reduces the negative impact of a risk factor on problem outcomes. Some examples include subjective sense of adult status, future orientation, achievement orientation, and a balance of autonomy and relatedness to family. There are just over 100 HBCUs in the United States. Nearly two-thirds of the private HBCUs are affiliated with religious organizations. Individuals and groups such as Booker T. Washington and American Temperance Movement during the 19th century were involved in the founding of black institutions of higher education, and they kept character development and temperance at the core. HBCU's emphasis on character development has had a strong influence in reducing alcohol consumption rates on campus, and that can account for the correlation that we saw in slides earlier on. A representative from the National Association for Equal Opportunity in Higher Education noted that HBCUs provide a sense of community, a cultural atmosphere supportive to African American students, and a commitment to student retention. Anecdotal evidence also suggests that HBCUs cultivate a nurturing environment, and there are also some indications that the values and goals of black collegians differ from their white counterparts. These differences may explain not only why the figures we reviewed earlier on is lower than the national average, but also why black students in general drink less than other students too. We're going to now look at how to assess a community, which is your college's community, and see how prevention can best be implemented. In the first step, we have to ask what to assess. To change a problem, you must first understand it. Only then can you identify the best way to solve that problem. Assessment involves gathering data on the nature and extent of substance use behaviors and related problems, the factors that influence these problems in a community, and available resources and readiness of the community to address these problems. Once you know what the problem is and the risk factors, then you can select the best intervention using data or more objective decision-making processes. Conducting this process is sometimes referred to as needs assessment because the data collected during the assessment will reveal what a community needs for substance abuse prevention and related problems. The assessment should be able to answer the following questions about related problems in the community. These questions are: what are the behaviors and related problems? How much are they occurring? How frequent are these problems? And also, it is important that any organization or any group identifies which populations are experiencing these problems the most. Examples of data to collect on alcohol-related behaviors include ages of initial use, current use. These data are sometimes referred to as data indicators or archival data because they are often routinely collected by agencies and organizations, usually at the state level. In the chart that we're seeing is showing three categories of substance: alcohol, tobacco, and drugs, which is broader. It shows some of the behaviors associated with each of the substance, and then it shows related problems such as drug-related mortality, alcohol-related mortality, or vehicle crashes. All of these data can be used to properly assess the community and see where an organization such as peer educators should focus the presentations that they're preparing. As you look around on your HBCU campus, you may feel very overwhelmed in trying to identify what problems to address, which problems to address first, and is there a particular problem that is getting worse over time? How does this problem compare to another problem that you may identify? And what is the severity of the problem? All of these are topics or issues that you need to look at when you're properly addressing which program or which intervention you want to apply. Step 2 has to do with capacity, and capacity also involves sustainability. Capacity has two factors to it. There is resources and also their readiness. Capacity plays a part in reaching set goals. It refers to the resources such as programs, organizations, people, finances, expertise that a community has to address this problem and how ready the community is to take action and to address the identified problem. HBCU communities want to assess the various types and levels of resources that is available to them. These may include physical resources, as I mentioned, human resources, organizational resources, and other useful resources include knowledge of the way policies and politics are on the school campus. These may either help or hinder prevention efforts. There are several ways peer educators on HBCU campuses can collect data to aid in the prevention goals. Some of these methods include conducting the core survey, collaborating with the counseling center or other departments that collect data, key informant interviews, focus groups, distributing pre- and post-tests, all of which collect quantitative and qualitative data. To the listening audience, how familiar or how many of you have ever heard of or utilized the core survey? This survey is used by universities and colleges to determine the extent of substance use and abuse on their campuses. The Core Institute is the largest national alcohol and other drug database about college students drinking and drug use in the country. They offer a comprehensive range of cost-effective surveys that measure risky behaviors. It also measures how easy it is for students to access these drugs, and it will also help an institution understand the drinking and drug norms of their college campuses. The focus of core reports continues to be supporting sound quantitative assessments that inform and direct student life programming efforts for the benefit of students' health and welfare across the nation. Information gathered by our evaluation tools, by the core evaluation tools, will uncover alcohol and drug use rates on the campus. It will determine areas that should be maintained or improved. It monitors the results of changes made to the program design, and also it identifies which environmental factors are most influential. At this time, I would like to just briefly share some of the findings that we got from the UVI 2010 Core Alcohol and Drug Survey. In 2010, we distributed the core survey on both the St. Croix and St. Thomas UVI campus. We distributed 315 surveys in St. Thomas and 237 surveys on St. Croix. We selected classes based on the number of students enrolled, and majority of the classes that we selected were general education courses due to freshman and sophomore enrollments. I should also add here, before I share some of the key findings on the use of alcohol, I should share here that the legal drinking age in the U.S. Virgin Islands is 18 versus in other states where the drinking age is 21. From our report in 2010, it was highlighted that 63.4% of our students consumed alcohol in the past year, and that's the annual prevalence. And it also showed that 41.2 of the students consumed alcohol in the past 30 days. That is a 30-day prevalence. And we also looked at what age the students first used alcohol, and we looked at where students use alcohol and what areas they had more access to, such as private home parties, on-campus events, residence hall usage, or bar and restaurant usage. When we looked at the key finding on the issue of illegal drugs, it showed that 8.3% of the students are current marijuana users, and it also showed that 14.6 have used marijuana in the past year. Okay, so those were I was just highlighting some of the benefits of using the core survey. From this information, we were then able to tweak our PowerPoint presentations and review our strategies and information that we were given to our college students. We chose areas more suited to the students instead of just having general presentations on substance abuse, which can be helpful as well. In capacity building, we mentioned that there are two parts of the capacity building. A community must be ready to accept change, and also the resources must be available. In readiness, the main question to ask is, how ready is your community or your campus to accept change? How acceptable are they to programs, or how acceptable are they to the fact that there is a substance use problem and it needs to change? And also, does the community realize that students are dealing with ATOD problems? Cultural competency, which we will now focus on, refers to an ability to interact effectively with people of different cultures. Culture refers to integrated patterns of human behavior, and competence implies having the capacity to function effectively as an individual and an organization within the context of the cultural beliefs, behaviors, and needs presented by consumers and their communities. Culture, there is no single word that we can use or that I can use to define what culture is. It can be defined as a geographic location, religion, age, customs and traditions, political affiliation, sexual identity and orientation, and in each group of culture, there are always subgroups which we have to consider when we're working with different groups. In the cultural iceberg, which helps to explain how culture is viewed and the elements of culture, it says that 10% of someone's culture is easy to see. We can see it in the customs and we can see it in the way they dress. 90% is difficult to see. It is not easy to see or identify a person's values, their beliefs, or their assumptions. Why is cultural competency important? Why is it important to be cultural competent? Cultural competency is one of the main ingredients in closing the disparities gap. It is the way HBCU students and peer educators can come together and talk about health concerns, prevention messages without cultural differences hindering the conversation, but instead enhancing it. Quite simply, healthcare services that are respectful of and responsive to the health beliefs, practices, and cultural and linguistic needs of a diverse patient can help bring about positive health outcomes. Developing cultural competency is an evolving, dynamic process that takes time and occurs along a continuum. It is not always a straight or linear process. The National Center for Cultural Competence at Georgetown University Center for Child and Human Development describes the 6 stages of this continuum. We have cultural destructiveness, cultural incapacity, cultural blindness, cultural precompetence, cultural competence, and cultural proficiency, which is when culture is held in high esteem and used as a foundation to guide all endeavors. As a culturally competent professional in prevention and health promotion, one should be able to assess, build capacity, plan, implement, and evaluate, and we'll briefly look at each of the 5 areas. In assessment, one should be able to accurately assess the influence of their own values, perceptions, opinions, knowledge, and social position in their interaction with others. They should also be able to provide and understand that this process is not only cognitive, but attitudinal and affective as well. In building capacity, an individual should learn to be an ally to groups that experience prejudice and discrimination on their school campus. Help others learn to be an ally in their own cultural group, and also to help expand other people's knowledge of their culture and affirm and legitimize other people's cultural perspectives. In planning, one should be able to learn how to embrace new, ambiguous, and unpredictable situations and be persistent in keeping communication lines open when misunderstandings arise. Individuals should encourage their peers to see themselves in multicultural perspectives and encourage skill building. In the implementation phase, individuals should be able to encourage and accommodate a variety of learning and participation styles and include diverse perspectives in any given intervention. And finally, evaluate. Be skeptical about the validity of a diagnostic tool applied to people who are culturally different. Understand, believe, and convey that there are no culturally deprived or culturally neutral individual or group, and that all cultures have their own integrity, their own validity, coherence, and most importantly, that each culture and every person deserves respect. Once a college community has reached consensus on their priority, their risk and protective factors, they have made their assessments, they can begin to think critically about what intervention or what interventions to consider. They must identify types of interventions that address their underlying risk and protective factors in order to produce positive outcomes, select specific programs, practices, and policies in order for the intervention to be effectively implemented. And evidence of effectiveness refers to whether an intervention has previously demonstrated evidence of being effective, which means that it was evaluated and it is found to be effective under particular circumstances. This is a list of some evidence-based resources, some websites where you can get access to different evidence-based programs. Moving forward, campuses have been making strides in ATLD prevention, and each offers a unique perspective that can be shared with other campuses to help enhance their prevention efforts. Some specific recommendations include engaging more with individual students, increase faculty involvement in non-academic issues such as career advice and personal mentoring, provide more opportunities for community service, offer more mentoring programs, strengthen ties to the community, collaborate with local prevention coalitions and community-based organizations. As Dr. Harrington mentioned in my introduction, I am currently the U.S. Virgin Islands CSAP Prevention Fellow. CSAP, the Center for Substance Abuse Prevention, was established in 1992 as one of the centers within SAMHSA. The SAMHSA CSAP Prevention Fellowship Program was launched in 2006 in an effort to build a workforce of substance abuse professionals. CSAP's goal is to improve the accessibility and quality of substance abuse prevention nationwide. The Prevention Fellowship Program, known as PFP, provides a career development and training program that maintains a superbly trained cadre of competent and knowledgeable professionals. It is the hope that each fellow's experience with PFP will enhance their knowledge and understanding of the principles and best practices in substance abuse prevention and preparing them for certification from ICNRC and potential careers in the substance abuse prevention field. ICNRC is a certification board that oversees the granting of the Prevention Specialist certification, a certification that a fellow can test for having completed the 2-year fellowship program, which involves training, it involves participating in activities with your state agencies. For more information about the SAMHSA CSEP Prevention Fellowship Program or summer internship opportunities, you can visit this website, which will be available on the HBCU CFE website. These are my references. Thank you for your time. Are there any questions, any comments at this moment?
The HBCU CFE would like to acknowledge the creative and innovative talents of students and their faculty, staff, advisors, as well as our SAMHSA project officers and steering committee members and the rest of the CFE team.